was a challenge many days going in to work and trying to fulfill the duties of my job, because it is a very demanding job. I mean, after I would get off work, which is a long day, I mean, I just didn't have the energy, the stamina to really try to fulfill my home responsibilities. You know, many times I would go home and just lay on the couch. I felt awful. You have the packing, even though you know going in it's going to be there, and you know in your mind, it was just a very uncomfortable situation. I was still dealing with the packing issue and having to do numerous irrigations throughout the day, and that was not a good experience at all. And then I continued to have headaches. I was kind of bedridden for a while. What really was different about my experience post-operatively this time versus my first procedure is that when I became aware of my surroundings in PACU, I was breathing, and I had no packing. I had no bleeding, and actually it felt like I had a wind tunnel, and I mean that's the way it sounded because my passages were all open. How I feel today after having this procedure approximately a year ago, it's like I never had any sinus problems. I had my procedure done on a Friday, and I recuperated Saturday and Sunday and Monday, and I went back to work on Tuesday. But I could have gone back to work within 72 hours without any problem. My sinuses are what they were 20 years ago. I can breathe, you know, and I'm outdoors a lot. You know, I like to run, I exercise, and before, sometimes that was difficult. After the surgery, I think the word that sums it up is normal, because you know what normal is, and so I'm back to what I was many years ago when I didn't have any symptoms. So I'm back to being able to breathe. It's been a great experience for me to have this done and to be able to do the things that I like to do.
If what you just heard sounds familiar, you may be one of 37 million Americans suffering from chronic sinusitis. Symptoms of chronic sinusitis include facial pressure or pain, headache pain, congestion or stuffy nose, thick yellow-green nasal discharge, bad breath, or pain in the upper teeth. The sinuses are a series of interconnected hollowed spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies, and can swell up and block the nasal passages so that fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medication such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new, less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
The minute that I wasn't working out every day of my life, the problems that I had, they started to magnify. Doing some kind of physical activity became short of breath. If I was at work, broadcasting, I started having severe postnasal drip and taking allergy medicines, nasal pumps. I was trying to rinse my nose. I have a steam shower I was living in, trying to just, get as much of it out as I could. Watching the spicy things I ate because I felt like it was affecting my voice, maybe not having caffeine or stuff like that, just trying not to affect my voice. I mean, I thought it was, I was trying just about anything, all kind of homeopathic remedies and teas and stuff like that. I mean, I tried it all. I literally tried it all. I tried a hyperbaric chamber, felt like, let me see if I can get more oxygen by sleeping in one of these things. None of it worked. And it's crazy that it was such a simple procedure to get done to fix something that I struggled with for a long time. Not a lot of time out, not a lot of recovery time. And when I think about how I feel now and how I'm capable of breathing, it was an easy decision. If I had known about it early, it probably was, and if it was available earlier, probably was something that I would have gotten done a long time ago and not suffered through what I'd suffered through. I tell them that balloon sinuplasty is it's a must.
I woke up with a headache and my sinuses were congested. I sounded funny, my ears were blocked, and I constantly felt nauseated. I wake up in the morning and I just do regular routine things like every other person does. I get up, I make my morning coffee, and I don't have a headache. I don't have to worry about what I eat, what I drink. I don't have to worry about anything. As soon as I had the surgery, I woke up in the recovery room and I could breathe. I had the balloon sinuplasty technology in December, so it's been 5 months. And it was so, I feel it was so great. It was such a success. I golf, I play, I'm outside, I'm very active, and so it's almost like I forgot I had it. I had the surgery on Thursday. I didn't go to work on Friday, and it wasn't because of the surgery, it was because of the anesthesia. And I didn't have any packing, and I went to work on Monday. Normally when you have a surgery, you can remember because you still have some sort of pain or some kind of recovery that you need to go through. And I haven't had to experience that at all. I haven't touched an Excedrin or any kind of headache medication in 5 months, which is great, and I haven't had any antibiotics or any steroids at all. So I'm pretty much medication free as much as I can be. Prior to the balloon sinuplasty technology procedure, I had to always worry about where we were going. You know, my husband and I are very active. We snow ski, we golf, you know, we like to be outside. My son played football and lacrosse. Now he's in the Air Force, but at the time we were outside quite a bit. Yeah, I don't have to worry about anywhere I go. I can pretty much be spontaneous and do things. So if I golf and it's windy, it's no big deal. I can enjoy the day just like everybody else. My husband thought that because I had so much more energy and I was so much more fun, that he thought I was going through a midlife crisis. And I just told him, I said it's just because I can breathe. And so I would just tell people that if you are having problems, go see your doctor, see if that's an option for you, because your life, if that is an option for you, your life is going to improve 100%. If I ever needed to have the surgery again, I would do it in a second.
When I was having problems with sinusitis, first of all, I would feel a little bit embarrassed because I was coughing and sounding stuffy in front of my patients, and they were coming to me to get treatment, not to get sick. You know, I have some grandchildren, and I like to spend time with them, and I wasn't always in the right frame of mind to do that. So there was a general downer as far as my enthusiasm for life in general. The balloon sinuplasty, after I had it done, well, the next day I was feeling like $1 million, and you couldn't tell that I had anything done. And so, as far as I'm concerned, it was a worthwhile procedure, and the results to date, anyway, which is over a year ago, have been much better. I was basically not out of commission at all. I mean, I could have gone, even the way I think we did it on Thursday and was off Friday, I could have gone back to work that Friday if I wanted to, and I had, you know, no significant bleeding or no need for packing, and so it was really quite a positive experience. I would be frequently having to take antibiotics, decongestants, and oral steroids. And since I've had the procedure done, I have had very few courses of antibiotics. I haven't had to take prednisone. I don't take decongestants, which is an issue for people, especially around my point in life, where they cause problems with insomnia and blood pressure situations you have to be worried about. So the fact that I don't have to take these decongestants has made it all around better for me. I'm able to work my full day, plus also have energy when I get home. If I wanted to go out or do something recreationally, I would be able to do it. So overall, I think it's made a tremendous difference in how I approach my day-to-day life. As far as a patient who I see in my practice who has these repetitive infections, where I've tried my best from my end to do what I consider the right medical thing, and has the blockage, certainly like I had, I wouldn't hesitate for a minute to recommend it.
In the morning, my face would be puffy, I would have a hard time breathing, underneath my eyes would be black. I wasn't able to exercise the way I'd like to because of the postnasal drip and having a difficult time breathing out of my nose. My activities were definitely limited with my sinusitis. There are several vacations that I didn't go because it was kind of far away from, say, medical care in case I had also some asthma issues related to the sinusitis. A few 5Ks I didn't do because I wasn't feeling up for it that morning. I didn't feel good. My face would be very bruised. I was in a lot of pain. I had some severe bleeding. I want to say that I probably missed several weeks of work total over the years, which was very frustrating to have surgery after surgery and not feel like you were really any better, or not feel like you could go out and do the things you wanted to do and not feel like you'd remedied the problem. I could smell smoke. I could smell that there was a fire close by. And so I thought, oh my gosh, I can breathe already, and it's just been probably an hour or 2 hours. It has been about a year and a half since my surgery with balloon sinuplasty technology, and I have felt great. I have not had the reoccurring infections every month. I'm able to breathe, I'm able to sleep at night. I don't have that sinus pressure up near my forehead. I have felt awesome. After surgery with the balloon sinuplasty technology, I went home, I took a nap, and by that evening I felt fine. Prior to the surgery, I took so much medication that it wasn't healthy for me. After the surgery, I've just had a few sinus infections here and there, but I've gotten on an antibiotic right away and it's gone away. It hasn't lingered. You have to find a doctor that, that's up with the newest technology, and those are the doctors that can help you.
People always felt that I had a cold, or they would say, "Oh, you have a cold," because I was stuffy. I had basic loss of smell and loss of taste. Those two senses were completely gone. At night, I would have to, I got to the point where I would have to sit propped up with pillows. In my work, I'm on the phone a lot. Probably 85% of my day is spent on the phone. Prior to surgery, I had to curtail my phone use. I am able to actually close my mouth and breathe at the same time, which I could never do. Speaking on the phone is, I have much more clarity, and the quality of life is just tremendously improved. One of the great outcomes is that this past allergy season, all of my coworkers are having a lot of problems. And I always thought that I was very much prone to allergies, but this season I have been allergy symptom-free. So I attribute it, of course, to the surgery. After my surgery, I took no painkillers. I was basically, I could have gone back to work within 2 days. I chose to have the surgery that utilized the balloon sinuplasty basically in lieu of taking medications as I viewed it for the rest of my life. It was the only alternative that I could truly see for me. I was able to actually taste food for the first time in a number of years, smell things. Some things that I didn't enjoy smelling, some things that were quite pleasant to smell once again. Just breathing and overall quality of life, increased energy. The entire process was very short, pain-free, and I would recommend it to anyone.